We begin this hour with a Health Watch story on new concerns about excessive screen time for kids. Research out today finds too much screen use for kids and teens ages 6 to 18 may be associated with a higher risk of future heart-related conditions like obesity, high blood pressure, and diabetes. CBS News medical contributor Dr. Celine Gounder is also editor-at-large for public health at KFF Health News. She didn't go far. She came back. Dr. Gounder, thank you so much. So this study is wild. How can screen time potentially affect heart health?
Right, so these researchers found that for every extra hour of screen time, there was an increased risk of obesity, high blood pressure, diabetes, even early heart disease. And this is on top of what we've seen in terms of impacts on mental health and attention span, particularly for kids who are getting less sleep. And look, it's not rocket science. If you're in front of a screen, you're probably not getting exercise, you're not active.
It's so hard for families to totally get rid of screens altogether. And I know, especially when you're traveling with toddlers, I'm thinking, whatever y'all need to do to keep the child occupied. So what do you say about how you should go about limiting time? How much is too much? Do you have any guidelines on how and when it should be used?
Well, there was a really interesting Harris poll conducted recently. Jonathan Haidt was, who I know has been on the show, who was part of this. And they surveyed kids, and we do not survey kids enough. We survey parents, but not so much the kids. And they asked kids about how they would prefer to spend their time. And they said in person, but without adults hovering. Online, kids have a ton of freedom. They're not really supervised. In real life, they are overly supervised. What they found was that more than a quarter of kids were not allowed to play unsupervised, even in their own front yard. And they estimate, experts estimate, that you would need to have a child playing outdoors unsupervised for 750,000 years to face the true risk of abduction. And so when you think about it in those terms, almost 1 million years outdoors unsupervised to get abducted, you know, we overestimate some of the risks of in-person, real life play versus the very real risks of online play.
So do they say how much you should let them use it or not use it? Is there
No, there's not a
guideline
specific cutoff. You know, I think number 1, number 2, number 3, encourage unsupervised play, especially outdoors where they're going to get more physical activity. We could really use Gen Z and Gen Alpha getting a big dose of Gen X childhoods. And then what we're also seeing now is a growing movement to ban or limit cell phone use in schools. Some of this is being done through legislation and regulation. New York's ban starts this fall, and it will be the largest state yet to have this kind of restriction. So we have a map there showing where we have restrictions and where we have legislation pending.
Good, very much in favor.
I might still peek out the window if they're playing outside. I'm that parent, just making sure.
Peeking is never wrong. We used to call it snooping back in the day. Thank you, Dr. Celine Gounder. Thank you very much.